Hello guys, today we'll talk about the anemia in pregnancy. So first of all, we will see the introduction. What is the meaning of anemia? First we'll discuss about anemia. Is the commonest medical disorder. It is the commonest medical disorder in pregnancy. Around 18 to 20% is in developed countries, and 40 to 75% is in developing countries like India. Anemia incident rate is like this. So definition we'll see here. Anemia is a condition in which the number of RBC and their oxygen carrying capacity will insufficient to meet the physiological needs of an individual, which consequently will vary by age, sex, attitude, smoking and pregnancy status. This definition given by WHO in 2013. So what is the meaning of anemia? Anemia is a condition where the number of RBC cell and their oxygen carrying capacity will insufficient to meet the physiological needs. So it is different according to the individual's age, sex, attitude, and in pregnancy also it is different. So anemia in pregnancy, according to WHO in 2013, anemia, what WHO defined, anemia is a pregnancy. Anemia in pregnancy is defined as hemoglobin concentration if it is less than 11 gram per dl. So we are telling us anemia. So if it is hemoglobin concentration is less than 11 gram per dl, then in pregnancy we can say the mother is an anemic mother. So here we'll see some classifications. If we will talk about according to value of RBC, there will be mild, moderate, severe and very severe. So mild, if it is 9 to 10, 10.9 gram per dl, that is mild. 9 to 10 we can say for easy remember. Moderate if it is 7 to 9, and severe means if it is less than 7 gram per dl, and severe very severe means less than 4 gram per dl. So these are the range according to value of RBC. These are the classification: mild, moderate, severe and very severe. Mild means 9 to 10, you can remember 9 to 10, moderate 7 to 9, and severe less than 7 and very severe less than 4 gram per dl. So let's talk about the classifications of anemia. There will be two classifications: physiological anemia in pregnancy and pathological anemia in pregnancy. So under physiological anemia, there again it is classified into some types. First one is nutritional anemia, then second one is hemorrhagic anemia, third one is hemolytic anemia, fourth one is bone marrow insufficiency, and the fifth one is hemoglobinopathies. So these are the classifications of anemia. First one is physiological anemia of pregnancy. So we'll talk about physiological anemia. Before that we'll talk about the pathological anemia. So under that, as we discussed, first one is nutritional anemia. Pathological anemia is again classified into 5. First one is nutritional anemia, that is due to iron deficiency, folic acid deficiency, protein deficiency, vitamin B12 deficiency. Second one is hemorrhagic anemia. Hemorrhagic anemia under the two types: acute and chronic hemorrhage. Acute hemorrhage means in early pregnancy, like APH and all, that is antibiotic hemorrhage, that is called as acute hemorrhage. Chronic means bleeding, means continuously she is having bleeding, like due to any infections, hookworm infestations, bleeding piles, that is chronic. The next one is hemolytic anemia, third type under the pathological anemia. Third one is hemolytic anemia. Hemolytic means it is again classified into familial and acquired. Hemolytic under that familial means congenital anexia, sickle cell congenital anemia and sickle cell anemia is coming under familial. Acquired means, so familial means already it is there, it is present in like congenital things, that is hemolytic. hemolytic familial anemia. So congenital anemia, if it is there, and sickle cell anemia, so we can say it can cause anemia, that is called hemolytic. Okay, then next we'll talk about bone marrow insufficiency. Fourth one is bone marrow. Fourth one is bone marrow insufficiency under pathological anemia. So here what are the bone marrow insufficiency, what will cause? Like hypoplasia means abnormal RBC productions, aplasia absence of RBC production. So we know RBC is producing from the bone marrow. So bone marrow, if any problem will happen with the bone marrow, then hypoplasia will occur. Hypoplasia means RBC, abnormal RBC will produce. Aplasia means absence of RBC productions due to insufficiency or due to severe infection or drops in a bone marrow, due to severe infection in a bone marrow, that cause bone marrow insufficiency. Two condition will occur: hypoplasia, aplasia. Then the last fifth one is hemoglobinopathies. So hemoglobinopathy is also like congenital. So here RBC, sickle cell disease, due to sickle cell disease, abnormal structure of RBC, these are causing hemoglobinopathies. So here abnormal structure of RBC forming due to hemoglobinopathies. So these are the classifications of classification under pathological anemia. Next we'll talk about the physiological anemia in pregnancy. So here the pathophysiology of anemia, this is one of the first type, first classification of the anemia in pregnancy. What is that? How it is? What are the changes occurring here in pregnancy? We'll see. So in pregnancy, the maternal plasma volume will increase by 50%. We can say 1200, around 1200 ml will increase plasma volume by term, and RBC also increasing 25% by term, around 300 ml plasma also increasing. So when it occurs, when plasma volume and RBC is increasing, they label 50% and 25% is RBC, hemodilution will occur. So here, due to hemodilution, iron deficiency will occur, because hemodilution occurs means here hemo concentration will occur, and iron deficiency will occur, which cause anemia in the pregnancy. So let's we'll see about the normal requirement in प्रेगनेंसी. ए प्रेग्नेंट वुमेन हाउ मच, कितना चाहिए उसको प्रेगनेंसी के टाइम पे, कितना आयरन चाहिए, कितना कहाँ पे यूज़ होता है, कितना प्लासेंटा को कितना आयरन चाहिए, वो सब हम पढ़ेंगे अभी. ड्यूरिंग प्रेगनेंसी टोटल रिक्वायरमेंट ऑफ आयरन इज़ 1500 mg. सो 1500 mg हमें नॉर्मली हमें चाहिए प्रेगनेंसी के टाइम पे, because as requirement for fetomaternal transmission, routine excretion, placental requirement during labor process. So